support.
Their friends and family.
A lot of mental health problems.
Support.
Suicide. Effectively destroyed the relationship.
Like coping mechanisms to treat.
That did nothing towards the relationship.
Mental health problems.
Negative effect on the
Their own issues. Communication. The right to the
fix them. Easily not
What's the first thing that comes to mind when I think of mental health? That is a huge question.
A list of just mental health disorders. The very first thing that comes to mind are friends and family that are affected by mental health and my own sort of experience with my mental health.
The negative effects of having poor mental health, depression and suicide. I guess those are the two things that bring people's attention to why it's important. So that's what comes to mind when I think about it.
I used to feel that if a person is strong enough mentally, then it might not impact in any way the mental health. But now I feel that it doesn't matter how strong you are. It can happen to anyone.
Probably the number of people I know that have had experience with like different mental health problems. I feel like pretty much everyone knows someone or has experienced some issues themselves.
I have a friend who had a lot of mental health problems, and before she'd opened up to me about it, I hadn't really thought about my mental health. So when it gets talked about, my first thoughts are for her and everything that she went through and what she taught me about my own mental health as well.
Like self-care and communication and like support. It relies a lot on the support of the people around you as well as your own like coping mechanisms.
A lot of the time, by the time someone is seeking professional help, they have come a long way already in recognizing the problem and acknowledging that they want to make a change themselves. And so I feel like, yes, most of the time I hear friends that have started seeing a psychologist, they've said that it's really helped them with like different coping strategies.
Seeking out for help is the number one thing that a person should do if they're struggling in any sort of way, not even mental health, to be honest.
If everyone should go to a psychologist, honestly, just because it's so good for you to learn how to communicate your issues and actually talk them through and learn why you feel the way you do and how you process things and your coping mechanisms. That's all so important, and it's not taught in school. And I think if people were able to get that help, there would be so many less people reaching breaking point.
So she went and started seeing a psychologist a couple of years ago, and in those 2 or 3 years since she's been there, she has gotten just immeasurably more happy and confident with how she's dealing with her problems, and she only has good things to say about going and getting help. It's definitely turned her life around. It's an amazing job that they're doing.
I feel like I don't know where I'd be without mine. Like, she's amazing, you know. I've learnt and I've grown and I've matured and I've gained so much from her, and I have so much to thank her for.
When people talk to their friends and family and get support with their own issues, like that's helpful, but at the end of the day, like we're not professionals and we don't have the training.
When it comes to other people's mental health, I used to be a sort of caretaker in a way and sort of try and fix them, which I've tried to reel back and no longer do, as I realized that had a massively negative effect on me and it did nothing towards the relationship. Now it's more I tend to more listen and support but not get involved.
We all, you know, if you're a really empathetic person and you see your friend going through something, all you want to do is to be able to help them in any way possible you can. But I think the issue with that is that I'm not a psychologist and I don't have the proper training in how to help people in the ways that they need it sometimes, especially if this person is potentially going on living with an undiagnosed disorder, which could be heavily impacting their lives.
I feel like at first it was kind of a scary thing and I wasn't really sure how to like provide support, but now I feel like I know more about it. And when people tell me that, like whether it's to do with like an eating disorder or just general like anxiety or depression, I feel like I'm able to support them but not take on a role as their therapist and not get myself like too involved in their situation. But I feel like I'm comfortable discussing people's mental health with them if they want to.
When they're experiencing poor mental health, talking to a psychologist or a counselor is my first go-to before I try to, obviously be there as a friend, but professional help's the most important thing.
Not wanting to be there to listen all the time to someone's, negative experience or negative experience with mental health is okay. You're not a horrible person for going, geez, I'm really overwhelmed with this. What I mean is, if you then go, have you thought about going to see a psych? You can set those boundaries. That person can go to a psychologist, get the help they need, and then you can support them in that sense.
My psychologist plays a different role in supporting me than my family and my friends, because I don't feel like it's appropriate to unload onto them as much, but like it's a psychologist's job to help someone improve and maintain their mental health. So it's a bit different.
Doing the mental health test that allows you to get the mental health plan and see a psychologist, it isn't super difficult, but it's still an extra step that for someone that might be struggling with these issues might prevent them from making that first step.
And when things beyond your hand, you feel like helpless.
You really have to jump through a lot of hoops to even get to these psych sessions, and they're expensive, and so it's like trying to find the right one can almost be, just this enormous struggle and wait.
I don't want to tell people that you go to a psychologist sometimes because it might feel like, oh, there's something wrong with you. But it's really important, normal thing.
The biggest cause is the stigma that's still around it.
It kind of makes you feel like you have this shameful little secret, and it shouldn't be like that. It should be just a part of, normality to go see someone to talk about shit. Like, I don't know why it's this stigmatized thing. It's frustrating.
I guess if they haven't really received the education on like how a psychologist could help them, so they're just reluctant to, because they see it as like that's a very extreme stage, and I'm not like clinically insane, so I don't need to go do that.
I've had those reactions where people kind of go, the classic like, you're so happy though, you have so many friends though, why would you need to go to a psychologist? People don't understand what's going on in someone's life and what's affecting someone.
So you should be able to see a psychologist for any sort of issue that you're dealing with that should be normalized.
They're not crazy. They simply associate this word crazy with the mental health, which is not true at all.
Anyone can sit in that chair and they will have something to talk about, and that's valid.
And it takes amazing strength to do that.
Kind of hard to seek for help in this time.
Just a major stigma around mental health.
The education on like how a psychologist could help them.
It's a psychologist's job to help someone improve and maintain their mental health.
People don't understand what's going on in someone's life and what's affecting someone.
I had not even realised that she was having problems, and so it was a big wake-up call about my awareness for other people.
Obviously be there as a friend, but professional help's the most important thing.